Welcome to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I'm a functional medicine endocrinologist based out of Oklahoma City. If you are one of the millions of people who are struggling with chronic fatigue, this is the episode you don't want to miss today. I have brought on a chronic fatigue expert, and we dive into today all the causes of chronic fatigue. Now, the interesting thing about chronic fatigue is that a lot of people get this diagnosis, chronic fatigue syndrome, from providers. They get put in this box, they get given medications, and then just kind of pushed on. But they never get better. And so they see provider after provider after provider, and they do all of these things, and they stay tired. And a lot of times they get frustrated, and then they just kind of give up. And so I see these people. They come to Modern Endocrine. They've seen tons of providers. No one has been able to make them feel better. And so I really wanted to dive into chronic fatigue for you guys and let you realize that it's a bigger thing than you actually think. So I went and found an expert on chronic fatigue. So I have Alex Howard. He does summits on this. He has an entire clinic based around this, and he's done lots of research into chronic fatigue. So today I asked him, tell me about fatigue. Tell me about the mental fatigue, about cellular fatigue, emotional fatigue, physical fatigue. How are they different? How are they related? What causes these different types of fatigues? What is the most common fatigue that you see in people? What is the most common type of fatigue people have that they don't even realize? So sometimes, guys, you have things driving your fatigue and you don't even realize you have it. And so we talked about these different boxes that he looks at with fatigue. He looks at not only your hormones, which a lot of people know about now. He looks at your digestive system because there are abnormalities in your digestive system that can lead to fatigue. Your immune system. So when you actually are chronically stressed or you have a chronic autoimmune condition, it requires more energy. And so we talked about that. How your nervous system plays a role. How your mindset and actual trauma plays a role into your fatigue. And until you understand all the different pieces, he calls them the jigsaw puzzle pieces. Until we understand all of these pieces and how they can contribute to fatigue, it's going to be almost impossible to actually feel better. Now, sometimes people do, he says, get some sort of treatment and they do get better. Their chronic fatigue gets better. But then a lot of times we fall back and we become fatigued again and we don't know why. And so he explains how all of this works. He talks about cellular energy production and how that is a huge component of your mitochondria, but also your mitochondria have something called a danger signaling response, and how you have to balance this danger signaling response with your cellular energy production in order to make sure people don't feel chronically fatigued. So it was a very amazingly interesting episode. It's packed full of stuff. So I hope that you guys find this beneficial. And we did also talk about toxic self-talk and how you treat yourself is very important for your fatigue as well. So Alex Howard is the founder and chairman of the Optum Health Clinic. It's called OHC, one of the world's leading integrative medicine clinics. It's based out of London. He has a team of 25 full-time practitioners supporting thousands of patients in 50 plus countries. They use integrative therapeutic coaching with functional nutrition. Alex is the creator of the therapeutic coaching method, and since March of 2020, he's been documenting his therapeutic work with real life patients via his In Therapy with Alex Howard YouTube series. It's very interesting. You should check it out. In the last few years, Alex has created some of the largest online conferences in the mental and mind-body markets, including the world-leading Trauma Super Conference. Alex's online conferences have been attended by over 1 million people. He's also published academic research in things like the British Medical Journal Open and Psychology and Health. And he's the author of the following books: Why Me and Decode Your Fatigue. Alex's latest book, It's Not Your Fault: Why Childhood Trauma Shapes You and How to Break Free, is also available now. So I hope you guys enjoy listening to this episode because it was fascinating recording. So, thank you for joining us today on this episode of Hormones, Metabolism, and You. I'm really excited about this interview. I have with me today Alex Howard, and he's going to talk to us about fatigue. And we're going to kind of talk about fatigue in a multifaceted level. We're going to talk about how trauma affects fatigue, how your nervous system affects fatigue, and just fatigue in general. So, I want to start, Alex, by having you explain to the listeners how you got here, why you know so much about fatigue, and kind of what you do every day.
Yeah. Well, firstly, Cassie, thank you for having me. This definitely wasn't the career plan for my life. I found myself in my teenage years suffering from ME, otherwise known as chronic fatigue syndrome, and really spent the first couple of years waiting for the medical world to find the answers and going to see nutritionists, naturopaths, medical doctors, and consistently being told, look, you're just going to have to learn to live with this. And when you're 16 years old and being told that this is it for the rest of your life, it was hard. And I reached the point that it wasn't that I was actively planning how I was going to end my life. I just couldn't, the thought of continuing living on the path that I was on just seemed impossible. And I had a conversation really where I was helped to realize that if I wanted the circumstances of my life to be different, then I was going to have to be the one to change them. And for the next 5 years, I wish I could say that I found the answer. What I found was there's not one answer, but there's many answers. And for me, that was a combination of understanding how my mind related to my body, but also how my body related to my mind. And I think I think for a lot of people suffering from debilitating chronic illnesses, one of the challenges is that you go and see a practitioner that has a particular way of working, and then for them that's the whole jigsaw. And that was really difficult because I was so desperate at the time that I would read the testimonials, I would start the protocol, and I would have this sort of like, oh my God, this is going to be the thing that changes it. And then would have the crash of the disappointment and the frustration. But over time, what I came to realize is it's a jigsaw. Like we have to decode what's happening in our physical body and then be able to map the pathway to recovery from there. And that was a 5-year journey. It was a challenge. It was 7 years in total, so 2 years waiting for someone to find the answers, and then 5 years on that path. But on the other side of it, I couldn't go back to just being on a whatever I don't know what a normal life is, but whatever a normal life is. I'd had such a extraordinary experience and discovered what is really possible when it comes to one's healing journey. I'd gone from that first couple of years totally debilitating fatigue, muscle pains, dizziness, being totally exhausted to the point all you want to do is sleep, and then you can't sleep, and then you wake up the next morning, you think, is this all that there is? To getting back to not just not having symptoms anymore, but having optimum health. That meant being able to exercise and to work and do all the things that I wanted to be able to do. And so on the other side, I set up the clinic that I had wanted to exist in the years that I had been ill. And that was, and that is, now we're talking 20-something years later, the Optimum Health Clinic. And I would say a few of the things that were for me defining in terms of my own recovery journey, which have really influenced the way that we work as clinicians and the sort of approach that we take, is that the approach has to be personalized. We recognize that everyone's pathway is different. You and I were just touching on that before we started recording. It has to be evidence-based, although of course the evidence base is growing and is evolving, and a lot of things that we do clinically, and I imagine it's also true for you and your team, are on the edges of what mainstream medicine is doing, but we're developing and we're evolving and growing that. But it also has to be integrative, that you can't just work with one piece of the jigsaw. And, in a way, part of how I see it is that to have the best probability of being effective in working with the people we work with, is we need to be able to see as many pieces of that jigsaw as possible. In fact, my second to last book, which was a book on complex fatigue conditions, was called Decode Your Fatigue, because of course, to be able to map the path to recovery, we first got to decode, well, what's actually happening in that individual.
Yeah, so I'm sure that lots of people listening to this right now can relate to that. I feel like I have a lot of patients like this. I end up seeing a lot of people with, I don't know that you necessarily call them chronic fatigue, but they have lots of diagnoses. So they've been given diagnoses by lots of physicians or providers, but then the treatment option for those, they don't actually get better. So sometimes it is just, I see people all the time where I'm like, I don't know that you have rheumatoid arthritis. I don't know that you have, all these conditions that they say you have, IBD or Crohn's, or it's sometimes I think we really need to decode what's going on underneath. So like, how are you sleeping? And, do you have trauma? What is your mental state like? Things like that. And so, but the word fatigue, I would say that the number 1, 2, and 3 things that people come to our clinic complaining of is fatigue, weight loss, and the third is either fatigue and weight loss again, right? So like everyone can relate to that. And some of it I think is our chronic or is our crazy modern lifestyle as well, right? Where it's just like go, 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 and rest is never had. I think, you're in Ireland, right? You're in Europe. London. Okay. So you guys are a little better about it than we are in America, but still I feel like the modern lifestyle, leaves a lot to be desired for just rest and recovery and just being in nature.
I don't know if we are better than you. I think we're aspiring a bit too much to be like America in terms of the go, go, go. But anyway, yeah.
So I do find all this fascinating, and I like people to be able to get different perspectives on this. And so for fatigue in general, I feel like there's lots of different types of fatigue, right? I feel like there's mental fatigue, there's physical fatigue, there's emotional fatigue, there's actual real like cellular biochemical quantum physics fatigue, right? Because our body is actually made of electrons and cells that move with water and magnetic forces and things like that. So you can get into fatigue in lots of different ways, but I guess tell me or tell the listeners, like, what are the most common causes of fatigue that you find, that maybe the most common causes that people realize, and then some common causes that people don't even realize are causing this debilitating fatigue?
I think the first thing is to really define what it is that we're talking about, right? Because a diagnosis of, let's say someone has a diagnosis of chronic fatigue syndrome, that isn't really a diagnosis. That's a label for symptoms. Because what's really happened is you've gone and seen your physician and say, I feel tired and I feel tired all the time. So they've then said you have chronic, which means ongoing fatigue, and they've added the word syndrome at the end, but that's really just a name for the symptoms that you have. And to have effective intervention, we need to understand, what is it that's causing those symptoms? And again, as you sort of alluded to, there's a bunch of different ways of thinking about that and talking about that. But one way to think about it is looking at it from a cellular energy production perspective, like, are your mitochondria functioning effectively? And if they're not, or they're not recycling effectively, then effectively what's happening is you've got like a battery which is not properly recharged, like a rechargeable battery that's not really recharging. So you're working with a diminished amount of resource in the first place. So then, and in fact, we go back about 18 years ago now to the early years of the Optimum Health Clinic. We started doing ATP profiles or mitochondrial function testing with a lot of our patients. And initially it was, we just need to give raw ingredients to help make mitochondria. And so we're giving everyone, D-ribose and CoQ10 and magnesium, whatever it is, as raw ingredients to help the manufacture of cellular energy. And then what we started to notice was some patients did well with that and other patients didn't do well, but other patients who did better for a while. And it was sort of like you're helping the system, but you're kind of treating the symptom. You're not really addressing what's causing those deficiencies in the first place, which then goes back to really the essence of your question, which is that there's a whole bunch of factors that can cause your system to be depleted, or they can impact upon mitochondrial function. One way that I like to look at it is look at it from the perspective of different bodily systems. So, and I know this has a lot of crossovers with how you approach these conditions and how you're working them as well. But we can look at your digestive system. If we are not metabolizing or breaking down effectively and taking nutrients from food, we are not providing our mitochondria with the raw ingredients to make energy. So of course that's a whole piece of this jigsaw. And there's a whole load of things we can be looking at there. We can be looking at small intestinal bacterial overgrowth. We can be looking at gut dysbiosis more generally. We can be looking at parasites. We can come back to these people. Let's just I want to give the map and then we sort of come back. So we can look at digestive function. We also then need to look at hormone function. And I know this has been a big part again of your work, but one of the biggest impacts of our natural energy production being depleted is our hormones get stressed to compensate. One of the ways I think about particularly our stress hormones is they're like our backup or our reserve tank. So our main tank of energy goes down, in kick our hormones, and if our energy production's not working well, our hormones are working harder and harder to compensate, and then we have the impacts and the depletion of what's happening with our hormones. Of course, then we can factor in things like menopause, and we can factor in different chapters in one's life where there also are impacts happening to hormones. We've then got our immune system, right? And this is another whole big piece of this jigsaw, that if we have Lyme, or we have co-infections, or we have toxic mold, or whatever else may be going on, these are all loads and impacts on our immune system, and it takes a lot of energy to run our immune system. This is why if someone gets the common cold, you feel more tired, right? Like I had a cold a few weeks ago, and I did a nap in the afternoon. It's not a normal thing in my life, because you got less energy. Because if you think about it, if you've got, let's say, 100 units of energy a day, and normally your immune system needs 20, and you're fighting a cold and it needs 60, that's 40 less units for all the other things that you're doing in your day-to-day life. And so if one's body is ongoingly fighting immune loads, then there's a stealing of energy that's happening to be able to to support that. So we've got our digestive system, we've got our hormones, we've got our immune system. One of the major pieces in my body of work is also looking at our nervous system function, looking at the impacts of childhood trauma, looking at the impacts of normalizing to being in what I call a maladaptive stress response. So a healthy stress response is, you and I are walking down the street in London. We don't see or hear the buses are now electric. We don't hear the big red London bus. We then jump out the way because we need to get away from the threat or the danger. We get a big hit of adrenaline and cortisol, our stress hormones designed to help us respond to the danger or to the threat. And we've basically got three choices. We can fight, i.e. move towards the threat. We can flight to get away from the threat, or we can freeze and shut down and hope the threat passes us by. With the bus example, we're probably not going to fight the bus, so we're going to have to flight. We're going to get out of the way of the danger. Then, 10, 20, 30 minutes later, we're sat in a nice London tea room having a cup of tea, and our nervous systems have re-regulated. And that excess of stress hormones has gradually kind of come out of our bloodstream. We come back to homeostasis, or come back to balance. The problem is whether it's impacts of childhood trauma, whether it is coping strategies we've developed in response to those traumas, things like defining our self-worth by what we do and what we achieve. So we're always trying to push ourselves beyond our edges and our limits. But when we are constantly in a state of stress, often we don't realize. We normalize to the state that we're in. So if you're in a state of stress consistently, you get normalized to being in that state. That over time, again, is taking a huge amount of energy to resource and to fuel that ongoing stress response. So to go back to your original question, to effectively treat fatigue-related conditions, we first need to decode what's going on. It may well be that our mitochondria are impacted, but is the driver of that our digestive system? Is it our hormones? Is it our immune system? Is it our nervous system? It may be all of those factors, but we need to have that jigsaw. And to go back to then, your original question about my own recovery, the realization that you can't just target one of those pieces. We've got to decode the bigger picture to then be able to effectively map that path to recovery.
So I think those are all very great points. I have one question for you though. So you said hormones, digestive, immune system, nervous system. Do you put mindset into the nervous system, or is that something separate?
we look slightly differently. So yes, we would include that within nervous system, but then we also would talk about the things you need to do to get well, and we would talk about mindset as being part of that. And just a quick comment on that. Often initially, when one is suffering from a complex or a fatigue related condition, most of us have been conditioned that you get ill, you go to the doctor and they give you the drug or they give you the treatment. They do the thing that makes you feel better. And I imagine the majority of people listening to this are listening because they've tried that and didn't work. So part of particularly the chronic illness recovery journey is one has to become increasingly responsible for supporting oneself and navigating one healing journey. We talk about it as the idea of becoming captain of the ship of your own healing journey. Doesn't mean you have to do all the jobs on the ship, but you do need to have that overall responsibility for what's happening.
Yeah. And so same thing with trauma. Do you put trauma in this like nervous system bucket, or does that have its own?
Yeah, we would put trauma as a driver of nervous system dysregulation. So we would, if we're going to use buckets, it would sit in the same bucket. Yeah.
So I think just kind of looking through this and as people listen, one of the things that I find that people are just, when they come to me and they say, oh, I'm fatigued, they come saying, thankfully we have all this education around hormones and thyroid. Like, I want you to address my thyroid. I want you to address my hormones. I want you to look at my insulin, maybe even if they know about insulin resistance. So a lot of people have some of this knowledge, which is great. This is wonderful. Social media has allowed people to learn this, but the things that I find that they miss that are just glaring are some of the things that you pointed out. So digestive support, right? So, I can figure out whether someone's actually digesting their food and their nutrients properly, usually after about 5 minutes of just listening to how they talk, right? Like, are they somebody who's like all over the place really quick? What do you do for work? What does your normal day look like? How do you eat? So I think one of the things that's alarming to me is like, we have lost the sense, at least in America, of, when you have a meal, you sit down, you're focused on your meal, you chew your food, you have it with people you love. Like, it's a time where you're calm and you're socializing and you're actually, your parasympathetic system, or your rest and, your relax system is supposed to be high, and you're eating food so that your body can actually absorb it. I would say that 95% of Americans that I see, at least in my clinic, are eating while in their car, walking around doing something, watching TV, on the phone, charting on their patients, whatever, playing on their phone. Like, we've just lost these tiny little things that are like so important to digestion, right? So there are so many people I see that are even morbidly obese that are chronically malnourished because their body is not absorbing the actual nutrients they need from their food. So I think that's one thing that people don't realize when they're tired. Yes, you are tired if you're not giving your body the nutrients that it needs, right, to actually be absorbed from your food. And you may think, oh, well, some people say, well, I eat blueberries every morning, or I eat a banana every morning, but if, let's say, you're doing that and you're in a sympathetic state and not a parasympathetic state, that one antioxidant food that you think that you're nourishing your body with might not have even been absorbed from your bloodstream, right? Or from your gut. And so I think that's pretty alarming that a lot of people don't put that together. And then to your point as well, I mean, people have a lot of the hormone, but the immune system, like when you're chronically in the red, I tell my patients, if you're a car and let's say you're a Lamborghini and you're running your Lamborghini in the red 16, 17, 18 hours a day, just nonstop, go, 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 go. And we're never taking our Lamborghini in for service. We're never changing the oil. We're never, getting our service. Then the Lamborghini is going to stop running at some point, right? And that's where you start developing diseases, or you get tired, right? So it's just some of these very basic things that we've made very difficult, I think, in medicine. And to your point, I think these syndromes, chronic fatigue syndrome, whatever, and I mean this in the most respectful way as it can be, I think that doctors have these big egos and they must put people in boxes and then figure out how to, give them a medication to fit in that box, because that's just what we were taught in school. And so that's what we do. And that's not always the best thing to do, to give somebody this diagnosis, because then they're like, oh, I have this diagnosis of chronic fatigue. I can never, I'm going to be tired forever. And it's almost like they shut down. And so those are kind of my thoughts.
Well, yeah, and also just to build on that a little bit as well. You were mentioning about how, one has, their habits, their behaviors, and they sort of, that's just, they don't necessarily see the impact of that. I think it goes broader as well, because we normalize to whatever state we are consistently in, right? So a lot of my work is looking at the impacts of childhood trauma. And just to say, I mean, trauma in the broadest definition of trauma. So yes, that can include adverse childhood experiences, things like physical abuse, sexual abuse, and so on. But it's also including just not really getting our core needs met in the ways that we needed in childhood. But one of the impacts of that is our nervous system starts to speed up. So we go into what I call a maladaptive stress response, where we are effectively, because our system is responding as though we're in some kind of danger, we are producing stress hormones consistently so we can fight a threat, flight to get away from a threat, or freeze and shut down. I remember early years of the Optimum Health Clinic, so we're talking 20 years ago now, and I would be explaining a sort of primitive version of this impact about the relationship between trauma and stress and the nervous system and the impact of that upon health conditions. And people would say, what you're saying makes sense. Like, I understand what you're saying, but I don't think that's true for me. And yeah, they would be so dysregulated that they couldn't sit still in the chair. They were talking so fast, I had to ask them to repeat themselves. And as a relatively empathetic person, I'd feel my own nervous system sort of becoming activated, being with this person. But they didn't recognize the fact they were in this dysregulated state because that was their normal state. I remember when I first started learning principles of, how to do guided relaxations and recording my own voice and listening back and thinking I was talking slowly and then realizing that my talking slowly was still speaking 3 times the sort of necessary speed. So we often just don't realize that we're speaking too fast, we're eating too fast, we're emotionally disconnected from ourselves, we're constantly pushing ourselves beyond our limits. We're not emotionally available in our relationships, whatever the issues are, because that's our normal. But just because it's our normal doesn't make it healthy, doesn't make it the state that we need to be in for our body to be well.
Yeah, 100%. And to your point too, so you have a couple videos that I thought were very interesting. You have a video on YouTube about toxic self-talk and what it is and how to stop it. And then you have one about you have to love yourself before you love someone else. Both of those things resonate with me a lot just because I was explaining to you whenever I meet someone for the first time and they're kind of, patients come in and they're going to talk for 5 or 10 minutes about themselves and they're going to tell you their story and why they're there. And I can tell when somebody's talking about themselves how chronic and nasty and toxic their mindset is because they talk badly about themselves, right? Like everything they say is, well, I suck at this, or I've tried this and all I do is fail, or it's very interesting. And when you kind of dive into that, a lot of times these people are in either abusive relationships and not necessarily physically abusive, right? They have a spouse that's very mean to them because they've been sick for a long time. And so they start telling them, you've got to get over it, or you've got to, just get up, or why can't, whatever. And so it's just interesting because I have found that those people that have all that, that talk badly about themselves, that have a lot of just this chronic negative self-talk, it is almost impossible to make those people better. Like I talk to them about going to therapy. I talk to them about, I like to ask them, I like to point out to them, it seems like you have a lot of negative things to say about yourself. And they'll usually say something like, well, yeah, that's because I've tried a million things and failed at everything. And, I'm always like, okay, well, would you speak like that to your son or daughter or your best friend? And they're always, no. Okay, well, then why are you speaking like that to yourself? And the sad thing is, these are thoughts that are going through their head all day long, right? Like we have tens of thousands of thoughts a day. And if a lot of them are negative about yourself, you're never going to get better or feel better until you change that, in my opinion.
Yeah. Well, here's a way to think about it. The ways that we were related to in childhood sets up how we relate to ourselves. How we relate to ourselves sets up how we relate to other people. and the parameters of how we allow other people to relate to us. And so if we grew up in an environment where we were criticized, where there was sort of judgment and criticism in the environment, or we grew up in an environment where we just didn't really get what we needed, and so we interpreted that as meaning that we were not loved, or we were not seen, or we were not validated, or whatever it may be. That becomes internalized. And part of the reason why that becomes internalized is when we're small children, when our parents or our caregivers are not around, we're not ultimately safe, right? Like, we are totally dependent upon our caregivers to take care of us. So it is threatening to the infant when the parents leave. And so one of the things they do is they internalize the voices of the caregivers, partly from a perspective of comfort, but also to learn how to be the way that they need to be to then be safe, or to be loved, or to have the sort of the healthy boundaries that we need. And so these structures are primitive. These structures are at the core of our psychological structures. And again, it kind of goes back to what we were saying a little bit earlier about the nervous system. We're so normalized to it. Like, people are so normalized to their internal dialogue that it sometimes takes quite a bit of pointing out to actually help people see the way that they criticize themselves. It's like people can go on a high level, I have toxic self-talk, but to actually see it happening in action is a whole different type of awareness for someone to actually see that process happening. And then, as I was saying, that impacts how we talk to ourselves. How we're related to becomes how we relate to ourselves. And so, as you say, you can have someone that is constantly either in their own mind or even in the words they speak out to other people, criticizing themselves, putting themselves down, attacking themselves, judging themselves. But what that also does is we teach other people how to treat us. So if we are someone who is constantly criticizing ourselves, in a strange way, when we're around someone that criticizes us, that feels safe, feels familiar, because it's a mirror of the internal world that we have. You can get a pretty good clue of what someone's inner landscape is like by the way the people around them treat them in their day-to-day life. What you also notice is when people change their inner landscape, they start to have a different tolerance for other people treating them those ways in their life. So someone's constantly had toxic self-talk, and then I work with them to therapeutically change that, they often start to notice how they've got a whole bunch of people that are putting them down the whole time. And whereas in the past that wasn't really noticed, suddenly it's like, that's really not okay. But also, this inner landscape of toxic self-talk, of self-judgment, self-criticism, these toxic relationships that then get created by that, it is constantly driving our nervous system into this maladaptive state. And so again, one normalizes to being in a maladaptive stress response. They've learned this is how they've been related to, how they're relating to themselves, how other people now are relating to them. But to our nervous system, we never feel safe because we're constantly being judged and criticized and attacked. And then that nervous system dysregulation is directly impacting upon the physical body.
And that probably takes a lot of energy too, right? If you feel like if you're in this negative environment and you're always feeling like you're being attacked, you're always on guard. And so that's going to take extra energy as well. And so some of those people are never going to feel less tired no matter how much sleep they get if they're in these toxic, negative environments.
Also, just to bring another piece of our jigsaw in here, we were talking earlier about mitochondrial function and about cellular energy production. So Professor Robert Navio has done some fascinating work on what he calls cell danger response, which is looking at the mitochondria effectively have two functions. So function number one is cellular energy production. But they have a second function, which is danger signaling. Right? And think about it like this, like the canaries in the coal mine. So my paternal grandfather, who I actually never met, but he was a coal miner here in England. And the coal miners would have a canary in a cage that they would take down into the coal mine. And then if the canary went unconscious, that would be the warning sign that there'd been a gas leak. You wouldn't be able to smell the gas, but that would be the warning sign. Then they would all get out as quickly as they can, and then hopefully the canary would sort of come back to life. So this kind of became the phrase of the canaries in the coal mine, which is like the warning sign that there's a threat or a danger. because of how efficient our mitochondria are in the process of metabolism and so on, part of their job is internal danger signaling. They're like the canaries in the coal mine. When we are in a state of dysregulation, our mitochondria will deprioritize energy production so they can prioritize danger signaling. So that spreading of the internal message that there's a threat or there's a danger in the environment means that that's taking our energy, but also we're producing less energy because it's the same resource that's being used for the danger signaling, which is now not being used for the cellular energy production. And this is why we find that when we work with people to learn how to regulate their nervous system, how to switch off a maladaptive stress response, they often report a significant impact in their energy.
Yeah. No, it's so true. And I interviewed, I don't know if you know Dr. Bruce Hoffman, but he does a lot of mitochondrial work as well. I interviewed him recently and he talked about the cell danger signaling cascade and how you get stuck in that phase 1 instead of going to phase 2 and phase 3, and how much energy that takes. And that's how people end up chronically ill. And, it's very interesting, from a personal and personal and professional perspective. I personally got really sick in 2022 and I couldn't figure out why. I mean, I had some other health issues prior, but when I really started to unravel it, a lot of it was the toxic work environment that I was in, and as that has evolved over time, I was in med school forever and then residency forever and fellowship forever. And that is wildly toxic in the United States. All they do is teach you how to be terrible to yourself. And then as soon as I graduated, I went to work for a big hospital system, Mercy Hospital, and they also teach you how to wildly be incredibly toxic to yourself and your patients. And so that didn't work very well. And then I went into a private practice with another provider, and that environment just, I couldn't figure out why when I was there, I just was always like, everything that happened, it was very, I don't know, I just had these like jolts in my stomach where I didn't feel good. And then one day when I pulled up and I got that feeling in my stomach, I was like, it's this place that's doing that, right? And so, my professional career has evolved as well. And so I've had my own clinic now for almost 3 years. And it is interesting how that changes. And to your point, it's interesting how when you get outside of that and something re-triggers you, it's just like, no, so I have incidences every now and then where it will be a patient or it will be a person or just something will come into my happy work environment. And instantly I get that, like, just, I want to throw up, run, whatever. And before, the Cassie pleaser person that I would have just tolerated that. And now I'm just like, no, that's not going to happen. No. And so it is very interesting how that happens, how you just become, but for years, I just dealt with it, right? But I was also the tiredest I had ever been, the sickest I had ever been. And I couldn't figure out why, because my labs looked fine. And, I had a few gut issues and I couldn't figure that out. Well, that was because my nervous system was always like going crazy, right? So it is interesting how you just get used to it. Like it took me 2.5 years of working in a toxic environment to figure out, wow, this is why I feel like crap every day.
Well, one of the things that also happens when we learn in childhood to be sort of toxic and critical and hard towards ourselves is we also don't learn our boundaries, right? And we learn that our value and our worth is tied to what we do and what we achieve, and often also how we take care of and we help others, right? So we become ultra compliant to everyone else's needs. But in the constant saying yes to everyone else, we're constantly saying no to ourselves, unless our needs are completely aligned with what everyone else wants for us. And so what in healthy functioning, when we're in a toxic environment, what should happen is there should be an internal reaction that says this isn't okay. It's a little bit like in our immune system. So something crosses a threshold in our immune system and we have an inflammation response, if that's on the skin, or maybe we get like a rash or something on the skin, or if it's in our, I get seasonal hay fever. So if like it's in, in our nose or our eyes, we sort of get itching or we get dry throat, whatever it may be. So we have those reactions because something is crossing a threshold and our system is reacting to it. That should happen with our emotional body. So when a boundary is violated, we should become irritated, or we should feel angry, or we should feel like this sense like that boundary has been crossed. But if we learned in childhood that our value was tied to what we do and taking care of everyone else, or our boundaries weren't respected, or we weren't taught how to enforce our boundaries, then we can find ourselves in these toxic environments and not defending ourselves, or not leaving the environment, or not sometimes we can't leave the environment, sometimes we can't even do a different action in the environment, but we can at least validate in our inner landscape to go, this isn't okay. Like, I see what's happening, I don't like what's happening, I need to find my pathway through it, but at least we're validating our experience. And so it's a big part of the healing work that you shared in terms of your journey is the starting to realize that we need those boundaries. And ultimately, to say yes to ourselves, we have to say no to other people. And we have to learn how to put those boundaries in place.
And I think you also have to learn how to listen to yourself too, right? So I feel like, a lot of people will get these feelings, maybe like I did for years. I would get them like, oh, I want to throw up. Or, mine is always like a butterfly. I want to throw up and like run. Or like, it was always the same, but it was just like, well, that's there, move on. Like, it was almost like you've had that feeling thousands of times and, you just deal with it. And so I think the other problem is that people don't listen to themselves. So like, I'm writing a book right now, it's almost done, and it's about the gut hormone connection. And I talk about how there is this huge connection between your gut and your brain, right? Your vagus nerve, and that visceral feeling that you get that you want to vomit or no, or like, you have to listen to that feeling. So whenever I like reflect on things, because I like to do this now, the biggest mistakes I've ever made in my life, just the top 10, every one of them in my gut, I knew I should have not done. Like, my gut was just like, immediately, no. And I did it anyways, because I wanted to make someone happy, or because I always have that feeling it doesn't matter, or, and so I think learning to listen to that feeling is you have to do it. And to your point, like, some of it does, maybe stem from childhood, etc., and you can work through that. But even when you've worked through that, you just have to get to the point where, like, to your point, yes, you listen to yourself, you trust yourself, and you like, just don't tolerate it. And the more that you don't do that, my therapist tells me this all the time, Cassie, the more you don't allow those things when they do come in, even the little ones, you're just so intolerant of it. And it's true. Like, even little things that before I would have been like, I'm like, no. For instance, patients, like, I'll have a patient. If a patient comes in and yells at me or my staff, prior, I would have tried to calm them down. Now I'm just like, no, you need to find a different clinic, a different provider. Like, I don't even care. Like that. No, you just took my like sympathetic system up a notch, And my staff sometimes are like, really? I'm like, yeah, really. We're not tolerating that anymore. Because 5 years ago, I would have let him scream and throw things. And, because that was the environment that I was in. People threw things at the clinic I was at before. Providers threw things. People screamed. And I'm just like, no, like, none of that's happening anymore.
Yeah, well, it's loving oneself enough to set a standard for how you're willing to be in relationship with people, right? And we teach people how to treat us. And so, I have it sounds like you have quite a feisty clinic compared to, but the times over the years, it's like, well, when we had a patient once that was shouting down the phone at the staff, and I went and took the phone and said, I'm really sorry, we don't do business with people that speak to my staff like this. And they just got, we're just not doing it. And when your staff see you stand up for them and they see you go, this is not what happens in this environment. It's also a powerful message of intent of saying that, I'm going to defend this boundary. I'm going to stand up for actually what matters. And I think, a lot of the talk in the sort of healing, self-development world, I talk in my work about we all have three core emotional needs. And the first two are fairly obvious. We have a need for safety and we have a need for love. But the third need is the need for boundaries. That's the ability to say yes, the ability to say no to ourselves, to other people. But also it's healthy boundaries, particularly when we experience that in childhood, where we actually have parents or caregivers that give us edges, that when we push against those, we grow our strength, like we grow our personal power. And, part of our healing work is also reclaiming our strength and our power. And it's standing for ourselves, it's standing for the things that matter to us. And it's being able to pursue and go after the things in our lives that matter to us. And I think often there's a lot that's talked about around, cultivating safety and love. And that's all obviously really important. But we also have to reclaim our power. We have to reclaim our strength, and we have to stand for the things that matter in our lives. We have to, if we're in toxic relationships, it takes power and strength to get out of those dynamics and to carve out the kinds of relationships that we actually need that are going to support us moving forwards in our lives.
Yeah, and just to think about, again, all that negative toxic energy, how much energy that steals from you and robs from you, right? Like I think people don't realize it, that like if you get out of those relationships, or you get out of that relationship with yourself and you actually sit down and eat your food, like all the things you can do, like I think you made a very good point about if you have 100 units of energy a day, how do we allocate those the best way possible? And most people listening to this are going to understand that, right? Because we have a set amount of hours in the day, and most people have a million things they need to do, kids and work and life. And so if I have 100 units of energy today, how am I going to allocate those? And you want to feel well, and you're in the process of getting better. So you need, probably at least half of those repairing all the damage you've already had. We've got to pull from somewhere. If we still need energy to get out of bed, and we still need energy to go to work, and we still need energy to provide for our family, then we've got to reclaim some energy somewhere, right? And so it makes really good sense to reclaim that energy from all the negative things that are draining you, right? Whether it's what you're saying to yourself, what somebody else is saying to you, and sometimes that's hard to do, but I mean, you just do it. And people, I see this all the time: cortisol levels, insulin levels, sleep, hormone levels, they all astronomically get better if you'll just do that. And so sometimes, when you're chronically fatigued, although you feel like a drug or a pill or a hormone is going to make you feel better, and it may to a certain degree, the main thing you have to do is change your lifestyle, right? Like you have to take inventory and then start making some changes in the big things that you talked about, in mindset and hormones and digestive health, the immune system, nervous regulation, all those things.
Yeah, one of the things that I got really interested in the early years of running the clinic was, the kind of mission number one was, could we help people get well? And we figured out, every case is different. And I think anyone that claims to have all the answers, that should be a warning sign that they probably don't have as many as they think they've got. But I got really interested in, okay, we can get people well, but why don't some people stay well? Like, what causes relapse? Like, what are the cases where someone gets back to health, but they come back a year later or 5 years later and they've crashed again? Often in that instance, what's happening is there are underlying variables that have not really been changed, right? Like, so for example, someone's got a toxic achiever pattern where they're defining their self-worth by what they do and what they achieve, and they've got low self-esteem, so they're constantly driving themselves beyond their edges and beyond their limits. So they got sick, they got well, and then they spent the last 2-3 years constantly pushing themselves too hard again. Their system's crashed again, or someone has really poor boundaries and has a big people-pleasing pattern, and they're constantly giving to and taking care of everyone else. And when they were ill, they just couldn't do that. So in a way, they had like a temporary reprieve from the pattern because they didn't have the energy to do it. Then they've got well, and they've gradually found themselves back in all of those dynamics again. And so that's why we can't just see recovery as being about looking at the bodily systems that may be out of balance or may be impacted. We can't just look at what's happening in the nervous system. We also have to look at these underlying dynamics of how one relates to themselves, how one relates to other people, how one relates to the world, because these underlying dynamics are often what's driving whether our life is basically in balance or out of balance. And if our life is consistently out of balance, at some point, things are going to have to rebalance. And normally, the beginning of the path to rebalance is some kind of dis-ease.
Yeah, that all makes sense. So I think this was all very enlightening. Thank you for kind of talking us through fatigue and how you look at it. We'll definitely put all of your stuff in the show notes so people can find you. I know you have a very active YouTube channel, very interesting videos where you actually interview people and do therapy on them. So that is very interesting. And then I know you have several books, so we'll make sure that we get all that in the show notes as well. So I want to end by asking you 3 questions. I ask everyone these 3 questions, so don't overthink them. But the first question is, what is one food that's most beneficial and why?
I'm going to make myself unpopular for some people and go down the path of good quality animal protein, be that grass-fed beef or whatever it may be.
And why do you think that is? Just for the protein content? For
It's less of a thing these days because we've seen such a movement in recent years towards various forms of ketogenic or whatever it may be. But particularly in the early years of my clinical career, veganism and vegetarianism was hugely popular. And by the way, that has its place. Some people's bodies do super well on those programs. But a lot of patients that we work with have gone down those paths with the intention of improving health and have actually worsened their health outcomes as a result of it. So I'm being a little antagonistic, but
Alex, I feel like you're being a people pleaser right now.
maybe.
Set your boundaries and keep them. You said animal protein, people. Okay, so next question is, what is one thing that anyone can do to improve their health that is 100% free?
Hard one to do in this country, but get morning sunlight. It's the evidence is consistently shows it will raise cortisol in the morning. It'll also increase melatonin at night, which means that you'll wake up in a healthier, more natural way, but also you'll get better quality sleep. It's cheap, it's free. And even in the, if you're in the UK and we get a lot of cloudy days, you're still getting benefit. You just need to not be behind a window or behind sunglasses or whatever, but getting sunlight on your eyes, obviously not directly, but on your eyes and on your skin, big benefit.
Yeah, so not to be the dispopular one here either, but when I interviewed Dr. Bruce Hoffman, he said you must get morning sunlight for your mitochondria to function. And if you can't get it where you live, you need to move. That's what he said. I was like, oh. So London.
Well, the whole of the UK emigrates to Florida, but there we are.
I know. Well, and he lives in Calgary, and he's getting ready to move from Canada. So anyways, just putting that out there. And the last question that I have is, if you knew everything, so 30 years ago, what do you wish you would have known about your health 30 years ago that you would have done differently, knowing what you know today?
Okay, I think if I could sit myself down, the me of 25 years ago, who was very much on my own healing journey, one of the things I would say to him is, you've got to find the balance. And the balance, what I mean by that is, when I shared from my journey, the first couple of years waiting for someone else to find the answers wasn't good. But the next 5 years, I was so obsessed with trying to get well that there were times that was also not helpful either. And so I think one has to find the balance of doing the work. Like, you need to decode what's happening. You need to get the right practitioner support. You need to follow through. But if you're so obsessively trying to get well, you're so anxious about all of the symptoms that you've got, you're actually driving more of a state of nervous system dysregulation, which is actually slowing things down, not speeding them up. Put another way, those of us that have an achiever pattern have to be careful that we're not trying to solve the problem with the problem. So we need to be careful that we're not trying to achieve so hard at getting well that actually the very way we're approaching it is putting us more in the wrong direction. The thing I'm always keen to make the point on is that it's possible for people to turn around their health. I think sometimes, a lot of the people that we work with at the Optimum Health Clinic have tried a lot of things that haven't worked. And they've often been the person who feels like they're the only person it hasn't worked for. Now, arguably, one could say that's often, clinics blaming the patient rather than taking responsibility for the inadequacies in their own approach. But often people we work with will say things like, "I've tried everything," or they'll say things like, "This is the last thing I'm going to try." And no one has all the answers, and I think you should be scared of anyone that claims to have all the answers. But there are a lot of answers that are out there, and the majority of people we work with are making significant progress in improving their health. And sometimes what we need is those initial wins to show us that it's possible. That even if the journey is going to have some twists and turns and different pieces of that jigsaw, so I'm mixing my metaphors here, but different pieces of the jigsaw that we need to find, if you can make some improvement, you can make a lot of improvement. And so I think it's an important message for practitioners that this is a whole rabbit hole, but I think it's important that we be careful how we sequence intervention. I think sometimes practitioners are too quickly to go into things that make people feel worse before they feel better. And so I often think it's important to build things up first and to sort of have some positive wins. But it is possible for things to change. We have to do the work, but it is absolutely possible.
I love that. It's possible to change. And I agree with that. I feel like at Modern Endocrine, sometimes I tell people like, yeah, I'm going to give you a little bit of thyroid medicine, or I'm going to give you some hormone, or I'm going to whatever, because you need a win. Like you need a win, but this isn't the end all be all. Like this is not how we treat it. What we really have to do is focus on other things. So I think that's a very valid point for patients, but also for providers that are listening. And I do just don't give up. Like you're your own advocate. If you give up, then nobody else is going to force you to get better. And so that's why, I do this. That's why I know you do this. That's why I do the podcast, is just to teach people you are an N of one. You're responsible for your own body, your own health. And if you don't get the answers that you like from a provider that you go see, find another one. Like there are people that will be in your corner, and there are people that want you to get better. So I love that. So thank you so much for your time today and for joining us and helping teach our listeners more about fatigue.
Great. Thank you for having me. Appreciate the conversation.
Thank you so much for joining me for this last hour to learn more about fatigue and how your mental health, your digestive health, your immune system, all the things can play into fatigue. I hope that you found this interesting. If you personally are struggling with fatigue or chronic illness and you feel like any of this was powerful or was educational, please make sure that you share this with other people that you think could benefit from it. So anyone else that that could benefit from hearing these things, if you know people who maybe have a little bit of a toxic mindset, don't talk nicely to themselves, or just who are chronically tired or want good educational information, please share this with them. Make sure you're following us anywhere you get your podcast. We are on Apple, Spotify, and we're on YouTube. So check out our YouTube page as well. We put a lot of educational information on YouTube about these things, gut health topics, hormones, etc. I'm very active on social media, so please make sure you're following us there. Let me know who you want me to interview you, what topics resonate with you, what you want to learn about. I'm happy to get you all that information. You just got to let me know. And lastly, remember that Modern Endocrine has a license in 39 states and counting. We are working on being in all 50 states by the end of the year. If you are interested in being a patient, we do virtual visits, so you can do them from home. If you're in the Oklahoma City area, we'd love to see you in the clinic, but we can do those virtually as well. We have lots of practitioners who are trained by myself. We are so interested in making you better. We do a lot of gut health stuff, a lot of mitochondrial chronic fatigue work. We love hormones. We'll help you with weight. Whatever you need, we're here for you. We have an amazing health coach as well who does a lot of nutrition counseling also. Thank you so much for your time this week. I hope you found this educational, and we look forward to you joining us next week on Hormones, Metabolism, and You. Have a great week. The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems, or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.